Many seniors continue wearing the same type of shoes they have worn for years without realizing that their feet and legs change with age. The structure of the feet naturally alters over time, leading to changes in arch height, foot width, and overall sensitivity. Shoes that once felt comfortable may no longer provide the support needed, leading to discomfort, poor posture, and an increased risk of injury. One of the most common mistakes is wearing shoes with hard soles, minimal cushioning, or inadequate arch support. Such footwear does not absorb the impact of walking, causing extra strain on the feet, knees, and lower back. Additionally, shoes that are too tight can lead to blisters, calluses, and restricted blood flow, while those that are too loose can make walking unstable and increase the risk of falls. Worn-out shoes with uneven or flattened soles are another major issue. Over time, shoes lose their structural integrity, and the lack of proper grip and support can alter a person's gait, leading to joint pain and discomfort. Many people do not realize that walking in unsupportive shoes for extended periods can cause long-term misalignment in the body, leading to chronic pain in the legs and back. To fix this issue, it is essential to choose shoes that provide proper stability and comfort. Footwear with cushioned soles, arch support, and a snug but comfortable fit can significantly improve walking posture and reduce strain on the lower body. Seniors should also check the soles of their shoes regularly. If they are visibly worn down or feel uneven while walking, it is time for a replacement. Opting for orthopedic or specially designed walking shoes can make a big difference in overall mobility and comfort. By making the right footwear choices, seniors can maintain better posture, prevent foot pain, and reduce the risk of falls or other mobility issues. Something as simple as wearing the right pair of shoes can go a long way in ensuring continued leg strength and stability. Many seniors develop the habit of walking barefoot at home, believing it to be more comfortable and natural. While walking barefoot may feel good in some cases, it can actually lead to several problems over time, especially for aging feet that require more support and protection. As people age, the natural padding on the soles of their feet starts to thin out. This padding acts as a cushion, absorbing the impact of each step and protecting the bones and joints from excessive pressure. Without adequate padding, walking barefoot can cause discomfort and increase the risk of pain in the feet, heels, and even knees. The lack of support also puts extra strain on the arches, leading to issues such as plantar fasciitis, a painful condition caused by inflammation of the tissue that runs along the bottom of the foot. Another major concern with walking barefoot is the increased risk of injury. Hard floors, such as tile, wood, and concrete, provide little to no shock absorption, making every step harder on the joints. Additionally, smooth surfaces can be slippery, increasing the chances of accidental falls, which can be particularly dangerous for seniors. Even small objects on the floor, like a tiny pebble or a misplaced item, can lead to minor cuts, bruises, or even more serious injuries. For individuals with conditions like diabetes, walking barefoot can be especially risky. Diabetes can cause nerve damage, neuropathy, reducing sensation in the feet. A person may not notice small cuts, blisters, or sores, which can lead to infections and complications if left untreated. Protecting the feet with proper footwear can help prevent such injuries and keep the feet healthy. To avoid these issues, seniors should consider wearing supportive indoor footwear. Soft, cushioned slippers with non-slip soles provide comfort and stability while protecting the feet from hard surfaces. For those who prefer the feeling of being barefoot, wearing socks with grips on the bottom can be a safer alternative. Taking care of foot health by avoiding prolonged barefoot walking can go a long way in preventing pain, maintaining balance, and reducing the risk of falls or injuries. As people age, occasional aches and pains in the legs may seem normal, but consistently ignoring leg pain can lead to serious health issues. Many seniors assume that discomfort in their legs is simply a natural part of getting older, dismissing it as something they must tolerate. However, persistent leg pain should never be overlooked, as it could be a sign of an underlying problem that needs medical attention. One common cause of leg pain in older adults is poor circulation. As people age, their blood vessels can narrow or become blocked due to plaque buildup, a condition known as peripheral artery disease, PAD. This restricts blood flow to the legs, leading to cramping, numbness, and pain, especially when walking or exercising. If left untreated, PAD can increase the risk of serious complications, including infections and even amputation in severe cases. Another possible cause of leg pain is deep vein thrombosis, DVT, a condition where blood clots form in the deep veins, usually in the legs. DVT can cause swelling, redness, and a heavy, aching sensation. If a clot breaks loose and travels to the lungs, it can result in a life-threatening condition called pulmonary embolism. Seniors who experience unexplained leg pain, especially if it is accompanied by swelling or discoloration, should seek immediate medical attention. Chronic leg pain can also be a sign of nerve damage, particularly in individuals with diabetes. Diabetic neuropathy affects the nerves in the legs and feet, causing tingling, burning sensations, or sharp pain. If ignored, this condition can lead to serious complications, including ulcers and infections that may require medical intervention. Joint issues such as arthritis can also contribute to leg pain. Osteoarthritis, which occurs due to the gradual breakdown of cartilage in the joints, can cause stiffness, swelling, and discomfort in the knees, hips, and ankles. Over time, ignoring these symptoms can lead to reduced mobility and an increased risk of falls. Seeking early treatment, including physical therapy, lifestyle changes, and pain management strategies, can help seniors maintain an active and independent lifestyle. Additionally, muscle weakness and imbalances can cause strain on the legs, leading to pain and discomfort. Many seniors experience muscle loss with age, making it essential to stay active and engage in exercises that strengthen the legs. Stretching, low-impact workouts, and walking can improve flexibility and blood circulation, helping to prevent pain and stiffness. Ignoring leg pain not only affects daily comfort, but also increases the risk of serious medical conditions. Paying attention to any discomfort, tracking symptoms, and consulting a healthcare professional when necessary can help identify underlying issues early and prevent long-term complications. Spending extended periods either sitting or standing without movement can have serious consequences for leg health, especially as people age. Many seniors find themselves in routines where they either sit for hours while watching TV, reading, or using a computer, or they stand for long periods while doing household chores or working. While both sitting and standing are normal parts of daily life, staying in one position for too long can negatively impact circulation, muscle health, and overall mobility. When a person sits for long periods, blood flow to the legs slows down, increasing the risk of swelling and discomfort. This is because prolonged sitting can lead to fluid retention, particularly in the lower legs and feet, causing them to feel heavy, swollen, or even painful. Poor circulation can also increase the risk of developing varicose veins, which appear as twisted, enlarged veins on the legs due to weakened vein walls and valves. In more severe cases, sitting for extended durations can contribute to the formation of blood clots in the legs, known as deep vein thrombosis, DVT. These clots can be life-threatening if they travel to the lungs and cause a pulmonary embolism. On the other hand, standing for too long without movement can also cause leg issues. When a person stands for extended periods, especially on hard surfaces or in one position, gravity forces blood to pool in the lower legs and feet. This can lead to swelling, discomfort, and increased pressure on the veins, raising the risk of conditions like varicose veins and chronic venous insufficiency. Standing for too long can also strain the muscles and joints, leading to stiffness, soreness, and fatigue in the legs. Over time, this can contribute to joint pain and increase the risk of developing musculoskeletal issues, such as knee or hip pain. One of the best ways to prevent these problems is to incorporate regular movement into daily routines. For those who sit for long periods, standing up and walking around every 30 to 60 minutes can help keep blood flowing and prevent stiffness. Simple exercises like ankle circles, toe taps, or stretching the legs while sitting can also improve circulation. For those who stand for long periods, shifting weight from one leg to the other, taking short sitting breaks, and wearing supportive footwear can help reduce strain on the legs. Maintaining a balance between sitting, standing, and movement is essential for leg health. Regular exercise, such as walking, swimming, or gentle stretching, can strengthen the muscles and improve circulation, reducing the risk of leg discomfort and serious health issues. By making small adjustments to daily habits and being mindful of how long they sit or stand, seniors can protect their legs and maintain better overall mobility. Trimming toenails may seem like a simple and routine task, but if done incorrectly, it can lead to several painful foot problems, especially as people age. Many seniors experience issues such as ingrown toenails, infections, and discomfort due to improper nail-cutting techniques. Because toenails tend to become thicker and more brittle over time, extra care is needed to ensure they are trimmed in a way that promotes healthy feet and prevents complications. One of the most common mistakes people make when cutting their toenails is trimming them too short. While it may seem like keeping nails very short will prevent them from growing too fast or becoming uncomfortable, it actually increases the risk of ingrown toenails. When a nail is cut too short, especially at the edges, the skin around the nail can fold over it as it grows back, leading to an ingrown nail. This condition occurs when the nail grows into the surrounding skin, causing pain, redness, swelling, and sometimes infection. Seniors, particularly those with diabetes or poor circulation, are more vulnerable to complications from ingrown toenails, making proper nail care essential. Another common mistake is cutting toenails in a rounded or curved shape. Unlike fingernails, which can be trimmed with a rounded edge, toenails should be cut straight across. This helps prevent the sides of the nail from digging into the skin and reduces the likelihood of ingrown toenails. Using sharp, clean toenail clippers and making small, precise cuts instead of one large cut can also help prevent splitting or tearing of the nail. In addition to improper cutting techniques, using the wrong tools can contribute to nail problems. Regular fingernail clippers are often too small and may not provide the necessary control for trimming thicker toenails. Instead, using specialized toenail clippers with a straight, wide blade can make the process easier and safer. It's also important to ensure the clippers are clean before use to reduce the risk of bacterial or fungal infections. Another important aspect of toenail care is maintaining good foot hygiene before and after trimming. Soaking the feet in warm water for a few minutes before cutting the nails can help soften them, making them easier to trim. After cutting, gently filing the edges of the nails can smooth out any sharp points that might catch on socks or shoes, reducing the risk of accidental tearing. For seniors who have difficulty reaching their feet, have thickened or fungal nails, or experience recurring foot problems, seeking help from a podiatrist or a professional foot care specialist is a good idea. Regular professional foot care can help prevent complications and ensure that toenails are trimmed safely. By following the correct techniques and using the right tools, seniors can keep their toenails healthy and avoid painful foot conditions. Proper toenail care is a small but important part of overall foot health. contributing to better comfort and mobility in daily life. As people age, their skin tends to become drier due to a natural decrease in oil production and reduced ability to retain moisture. This is especially true for the feet, which often receive less attention compared to other parts of the body. Neglecting to moisturize the feet regularly can lead to several problems, including dry, cracked skin, discomfort, and even infections. Proper hydration is essential for maintaining soft, healthy feet and preventing complications that could affect mobility and overall well-being. One of the most common issues caused by a lack of moisture is dry, flaky skin. The feet are exposed to friction from walking, pressure from shoes, and environmental factors that contribute to skin dryness. Without regular moisturizing, the skin can become rough, scaly, and prone to peeling, making the feet uncomfortable and unattractive. A more serious consequence of dry feet is cracked heels. When the skin loses its natural elasticity and moisture, it can develop deep cracks, especially around the heels. These cracks, also known as fissures, can be painful and may even bleed if they become severe. In some cases, cracked heels can become infected, particularly in individuals with diabetes or weakened immune systems, increasing the risk of complications. Another problem associated with dry feet is increased sensitivity and irritation. When the skin lacks moisture, it becomes more vulnerable to external stressors such as friction from shoes, exposure to harsh weather, and prolonged standing. This can lead to redness, itching, and discomfort, making it difficult to walk or wear certain types of footwear. Regularly applying a good quality moisturizer helps to prevent these issues by keeping the skin hydrated and resilient. The best time to apply moisturizer is after bathing, as the skin is still slightly damp and can absorb moisture more effectively. Using a thick, fragrance-free lotion or foot cream with ingredients like shea butter, glycerin, or urea can provide deep hydration and help lock in moisture. It's important to focus on all areas of the feet, including the soles, heels, and tops. However, moisturizer should not be applied between the toes, as excessive moisture in these areas can create a warm, damp environment that promotes fungal infections, such as athlete's foot. For those with particularly dry or cracked skin, wearing moisturizing socks or wrapping the feet in a warm towel after applying lotion can help enhance absorption. Exfoliating the feet once or twice a week, using a gentle foot scrub or pumice stone can also help remove dead skin cells, allowing the moisturizer to penetrate more effectively. If dryness persists despite regular moisturizing, or if cracks become deep and painful, seeking advice from a podiatrist or dermatologist is recommended. They can provide specialized treatments and recommend medicated creams to restore the skin's health. By making foot moisturizing a part of daily self-care, seniors can maintain smooth, healthy feet and reduce the risk of discomfort and complications. Proper hydration not only improves the appearance of the feet, but also supports overall foot health, ensuring better mobility and comfort in everyday activities. As people age, maintaining strong and flexible leg muscles becomes increasingly important for overall mobility, balance, and circulation. However, many individuals tend to neglect leg exercises, leading to a gradual weakening of muscles, reduced flexibility, and increased vulnerability to injuries. Regular movement and targeted exercises help keep the legs strong, support joint health, and improve blood flow, which is essential for preventing various foot and leg problems. One of the major consequences of not exercising the legs is muscle weakness. The muscles in the legs, including the calves, quadriceps, hamstrings, and glutes, play a crucial role in walking, standing, and performing everyday activities. Without regular use, these muscles begin to weaken, making movements less stable and increasing the risk of falls. This is especially concerning for older adults, as falls can lead to serious injuries such as fractures or sprains, which can significantly impact mobility and quality of life. Lack of exercise can also contribute to poor circulation in the legs and feet. The movement of leg muscles helps pump blood back to the heart, preventing issues like swelling, numbness, and varicose veins. When physical activity is reduced, blood circulation slows down, leading to discomfort, increased swelling, and a higher risk of developing conditions like deep vein thrombosis, DVT, where blood clots form in the veins. Poor circulation can also cause the feet to feel cold, tingly, or heavy, making it harder to move comfortably. Another issue caused by inactivity is joint stiffness. Joints need regular movement to stay lubricated and maintain their range of motion. Without proper exercise, joints in the knees, ankles, and hips can become stiff, leading to discomfort and difficulty in walking. Over time, this stiffness can contribute to conditions such as arthritis, making it even harder to stay active. To prevent these problems, incorporating simple leg exercises into daily routines can be highly beneficial. Activities like walking, stretching, and gentle strength training can help maintain muscle strength and flexibility. Even small movements, such as ankle circles, leg lifts, or toe stretches, can improve circulation and reduce stiffness. For those who have difficulty standing for long periods, seated exercises can be a great alternative. Lifting the legs while seated, stretching the toes, or using resistance bands to strengthen muscles can all contribute to better leg health. Additionally, engaging in activities like swimming, yoga, or Tai Chi can provide gentle, low-impact ways to keep the legs active without excessive strain on the joints. Maintaining an active lifestyle doesn't require intense workouts. Consistent movement throughout the day can make a significant difference. Taking short walks, standing up and stretching regularly, or even doing simple exercises while watching TV can help keep the legs strong and healthy. For individuals who already experience leg pain or stiffness, consulting a physical therapist or doctor can provide personalized exercise recommendations. They can suggest specific movements to strengthen weak areas, improve flexibility, and reduce discomfort. By making leg exercises a regular part of daily life, people can maintain better mobility, reduce the risk of falls and injuries, and ensure that their legs and feet stay strong and healthy for years to come. Many people tend to overlook the importance of regularly checking their feet and legs, assuming that if there's no immediate pain or discomfort, everything must be fine. However, neglecting routine self-examinations can allow small issues to go unnoticed until they become serious problems. The feet and legs endure a lot of strain every day, and without proper attention, conditions like infections, injuries, poor circulation, and even chronic diseases can develop without obvious early warning signs. One of the most significant risks of not checking your feet and legs is missing early signs of infections, cuts, or sores. Small wounds, blisters, or cracked skin may seem harmless, but if left untreated, they can worsen and lead to infections. This is especially dangerous for people with diabetes or poor circulation, as their wounds take longer to heal and are more prone to complications like ulcers or severe infections that could require medical intervention. Ignoring regular checks can also mean missing symptoms of circulatory problems. Conditions such as peripheral artery disease, PAD, can cause reduced blood flow to the legs and feet, leading to numbness, tingling, cold feet, or slow healing wounds. Without noticing these early signs, individuals might not seek treatment until the condition has progressed, making it harder to manage. Another issue that can be overlooked is swelling in the legs and feet, which may indicate underlying health problems. Swelling could be a result of standing or sitting for long periods, but persistent or severe swelling might point to issues like heart disease, kidney problems, or deep vein thrombosis, DVT, a condition where blood clots form in the veins. Regularly checking for unusual swelling can help detect these problems early, allowing for timely medical intervention. Changes in skin color or texture can also be a warning sign of potential health concerns. If the skin on the legs or feet becomes unusually dry, flaky, red, or discolored, it could indicate circulation issues, fungal infections, or even the early stages of skin conditions like eczema or psoriasis. Checking for unusual spots, rashes, or bruising can help identify these conditions before they worsen. Toenails should also be examined regularly, as changes in their color, thickness, or shape can signal problems like fungal infections, ingrown nails, or even deficiencies in nutrients. If nails become brittle, yellow, or start separating from the nail bed, it could be a sign of an infection that requires treatment. For individuals with diabetes, daily foot checks are even more critical. Diabetic neuropathy, a condition that causes nerve damage, can lead to reduced sensation in the feet, making it difficult to feel pain, cuts, or injuries. Without regular inspection, a small wound could turn into a serious infection without the person even realizing it. To prevent these issues, it's important to make foot and leg checks a daily habit. Taking just a few minutes each day to look for cuts, swelling, discoloration, or any unusual changes can make a significant difference in maintaining overall health. Using a mirror to check the bottoms of the feet or asking a family member for help if mobility is limited can ensure that nothing is overlooked. Keeping the feet clean and dry, wearing well-fitting shoes, and moisturizing the skin can also help prevent many common problems. If any unusual symptoms are noticed, such as persistent pain, wounds that don't heal, or unexplained swelling, it's essential to consult a doctor or podiatrist as soon as possible. By regularly examining the feet and legs, individuals can catch potential health concerns early, prevent complications, and ensure better overall foot health and mobility for the long term. Regularly changing socks and shoes is essential for maintaining foot hygiene and preventing infections. Wearing the same socks for too long traps sweat and bacteria, leading to bad odor and fungal infections like athlete's foot. Moisture-wicking socks help keep feet dry, reducing irritation and blisters. Shoes also need to be changed and properly maintained. Wearing the same pair daily traps moisture, increasing bacterial growth and bad odor. Rotating shoes allows them to dry, while replacing worn-out footwear prevents foot pain and misalignment. Keeping shoes clean, using antifungal powders, and washing them regularly further improves foot health. For those who exercise or have conditions like diabetes, foot hygiene is even more critical. Simple habits like changing socks daily, rotating shoes, and keeping feet dry can prevent infections and discomfort, promoting overall foot health. Not drinking enough water can have a direct impact on the health of your feet and legs. Dehydration affects circulation, leading to poor blood flow in the lower limbs, which can cause swelling, cramping, and discomfort. When your body lacks water, it retains more sodium, leading to fluid buildup, making your feet and ankles feel heavy and swollen. Hydration is also essential for maintaining the elasticity and health of your skin. When you don't drink enough water, the skin on your feet can become dry, cracked, and more prone to infections. Cracked heels, peeling skin, and irritation are common signs of dehydration affecting foot health. Muscle cramps and fatigue in the legs are also linked to dehydration. Proper hydration helps maintain the balance of electrolytes like potassium and magnesium, which are essential for preventing muscle spasms and keeping your legs strong and flexible. To keep your feet and legs healthy, drink an adequate amount of water daily, especially in hot weather or after physical activity. Proper hydration supports circulation, prevents swelling, keeps your skin soft, and reduces the risk of cramps and discomfort in your lower limbs.